The broadcast is now starting. All attendees are in listen-only mode.
Welcome to today's session titled Conversations with GIA, Getting Out the Count, Strategies for Optimizing 2020 Census Participation Among Older People. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your GoToWebinar control panel. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session today at the end of the presentation. And now I'd like to introduce John Feather, CEO of Grantmakers In Aging and moderator for today's webinar. John?
Thank you so much, and welcome to everyone. We are particularly thankful today for the support of the John A. Hartford Foundation for today's webinar and for the entire Conversations with GIA series. The 2020 census is upon us. How does the census impact older adults? And how do we ensure that older adults are counted? The upcoming 2020 census will shape policymaking and planning for the United States for the next 10 years. An accurate count is essential to ensure equitable representation in Congress and adequate funding for programs and services that benefit older adults. People aged 65 and over are considered a hard-to-count population. With funding from the Fan Fox and Leslie R. Samuels Foundation, the New York Academy of Medicine has developed a toolkit for aging service providers and other organizations that work with older people to optimize their census participation. Joining us today to talk about this important topic are Alana Kiefer, Program Officer at the New York Academy of Medicine, Alyssa Kias, Policy Associate at the New York Academy, and Dr. Julio Urbina, Vice President and Director of Healthy Aging Programs at the Fan Fox and Leslie R. Samuels Foundation. Thank you all for joining us. As was mentioned earlier, you can enter your questions to our panelists at any time, and I will be moderating that session, part of the session, and we'll come back to your questions at the end. But please go ahead and type in your questions as they occur to you during the session. Julio, let's start with you and have you share some background on the Fan Fox and Leslie R. Samuels Foundation and the Foundation's decision to support this important toolkit.
Thank you, John. I'll be happy to. I want to welcome everybody and wish everybody a great afternoon, and thank you for joining us today. I am Julio Urbina, the Vice President and Director of the Healthy Aging Program at the Fan Fox and Leslie R. Samuels Foundation. We're most known as a performing arts foundation, but we've had a healthy aging program for a number of years, and the mission of that program is to improve the quality of life of New York City's older adults. We're considered a mid-sized foundation with assets around $200 million. The Healthy Aging Program supports programs that provide direct services to New York City's older adults, and we support programs that have a model of sustainability tied to them. Part of the sustainability model that we've considered over the last few years, it really focuses on policy and advocacy and the importance of working towards changing the environment that our grantees are operating in order to be able to have sustainable programs going forward. Certainly this year, a major policy and advocacy initiative is the opportunity that comes along with participation in the 2020 census. There is a collaborative of funders outside of the aging space that has been formed to ensure that New York State gets the census, or people go out and make sure that they fill out and complete the census. But we found that none of the work that any of the collaboratives or the community-based organizations that they're working with target older adults. And we thought that there needed to be some strategy for engaging older adults, which led us to working with the New York Academy of Medicine. We awarded a grant of $80,000 to the New York Academy of Medicine to create a toolkit that will help organizations reach out to a historically difficult population to reach out to. So with that, that's kind of our background and why we chose to do this important work. It's my pleasure to introduce Alana Kiefer, the program officer at the New York Academy of Medicine, and Elisa Kias, who's the policy associate at the New York Academy of Medicine, who is doing this work.
Thank you so much, Julio. All right, we can go with the next slide. So we are so excited to be here today to tell you about our toolkit, which is called Get Out the Count, Strategies for Optimizing 2020 Census Participation Among Older People. My name is Ilana Kiefer, and you will shortly be hearing from my colleague, Alyssa Kies. Next slide, please. Next slide, thank you. All right, at the New York Academy of Medicine, our mission is to drive progress towards health equity, and we do this through three main mechanisms. We have our Fellows Program, which is a network of over 2,000 experts across the medical and public health professions. We have a world-class medical history library, and then we have a number of research, evaluation, and policy programs, including the Healthy Aging Department, which is where Alyssa and I work. Next slide. So what we're going to do today is we're going to talk about why, as Julio already really explained, why we were tasked with creating this toolkit, and then give you a kind of broad stroke view on the 2020 census. And again, this is relevant to you as individuals as well as professionals. And then we'll really go into some detail about who are the hard-to-count older adults throughout the country, and then give you some best practices for how to encourage participation among that population in the upcoming census. And our goal is that after today, you will truly understand the importance of the census and learn specific ways that the organizations that you work at and work with can encourage census participation, not only among older adults, but among people of all ages. Next slide. So there were really three main reasons why the Samuels Foundation really saw a reason to create this type of toolkit. The first one is that census data really determines funding for all types of programs that affect older adults. So that was, that's really kind of how probably many of the programs that we work with are really based on. The second one is that many older adults are considered hard to count. And the definition of hard to count is a group or population that has historically been undercounted and or have not responded well to the decennial census. And the decennial census is the census that happens every 10 years to count the entire country. And groups that are typically considered hard to count, there's a long list we'll talk about, but they might include ethnic populations, people who rent, and people who have low incomes. The third reason that we wanted to really create this toolkit specifically for professionals is that we know that those of you on this webinar and people who work with older adults around the country are really the ones that can have such an important impact on encouraging census participation. So we wanted to make this for you. And we just want to note right up at the beginning that we know that we are right now in the midst of a national crisis that is unfortunately disproportionately affecting older adults. But it's actually a perfect example of why the census is so important, because the data that we glean from the census really dictates where all the high concentrations of older adults are and ensuring that we have adequate funding to meet their healthcare needs. Next slide, please. So just briefly, in order to create this toolkit, we did a literature review on existing research related to census participation and older adults. The specific toolkit we wrote was with a New York City audience in mind, but the strategies that we provide are really universal. We then had interviews with 20 different experts at both New York City and national organizations that have expertise in specific hard-to-count populations, as well as a lot of information about the census itself. We also attended a number of city and state convenings to give us some more guidance on census education and outreach. Next slide. So let's talk about the census. The tagline of the 2020 census is to count everyone once, only once, and in the right place. It might sound easy, but we have to do that for 330 million people within just a few months. So we do have quite the task ahead of us. And as we know, the U.S. has quite a diverse population in many different ways, shapes, and forms, and we are quite a large population, and the older adult population is, of course, growing every day. So, as I mentioned, this is the decennial census. It's been happening every 10 years since 1790. It's an article in the Constitution to count the entire country. And the two significant things that the decennial census does is that it impacts representation in the U.S. House of Representatives, as well as federal funding of $675 billion, with a B, every year. We'll talk more about that as we go on, but I do just want to note that a lot of people talk about the funding, which is of course so important, but the congressional representation also has a lot of significance. In the 2010 census, for example, many states gained or lost seats. So, for instance, Florida and Texas gained multiple seats in the House, and New York and Ohio lost, I believe, 2 seats each. So it just shows how important it is to have an accurate count. Next slide. So today is what, March 11th? So starting tomorrow, you will actually be able to complete the census online, and everyone on this webinar and everyone you know will be starting to receive an invitation to respond in the mail to complete the census. You'll be receiving multiple invitations until you have actually completed the census. And then if you have not completed it by the middle of April, you will also receive a paper form to fill it out. So you can see on the right-hand side that there are actually 4 ways to complete the census. Online, by phone in multiple languages, as well as online in multiple languages, in print starting in the middle of April, and then if you still haven't completed your census by May, then census workers will start coming to your door to complete the census in person. And we just want to note, again, given the situation with the coronavirus, the Census Bureau is watching this issue very closely, and it has already, has kind of anticipated these types of issues and are working very hard on it. And this is actually a good example for why completing the census online or by phone is probably right now the kind of safest and easiest way to complete the census. Next slide. The census is available to complete online, by phone, and on paper in these 13 different languages, and these languages constitute almost 99% of languages spoken across American households. Next slide. It is probably no surprise to anyone here that a lot of people are concerned about giving any type of information to the federal government, and the census does ask for your name, your address, and your telephone number. But the Census Bureau takes its role as keeping your data safe and confidential very seriously. Information goes into the Census Bureau, and it only comes out in statistics. So if anyone expresses any concern to you about that, you can really assure them that their information will be kept safe within the Census Bureau. You can also see in the middle of the slide, there's a bold line. There is no citizenship question on the census. So we just wanted, there was obviously a lot of talk about it in the past year, but there is not going to be that type of question in the census form. Next slide. Okay, so some of you on the webinar might be working in group quarters, which are essentially like nursing homes or other places where people live in some type of congregate setting. So the Census Bureau classifies housing facilities such as skilled nursing facilities as what they call group quarters. Administrators who work at these facilities will actually work directly with the Census Bureau to count their residents. However, anyone that lives in an independent living or assisted living facility and has their own mailing address they will be sent their own invitation to respond to the census individually and will not be counted in this group quarters process. So, just if you are working, let's say, at a skilled nursing facility, we just ask that you make sure that the Census Bureau has been in touch with you to complete this process. And this group quarters process will take place between April 1st and June 12th. Next slide. Okay, so now that you guys are experts in the actual 2020 census, we want to provide you with some strategies to share this knowledge with the older adults that you work with. And what we do is we split it up into kind of three main sections. So we're first going to talk to you about how to target your outreach to find kind of the most hard-to-count older adults, and then specific strategies to motivate those people to actually complete the census and get their buy-in on why it's so important, and then to facilitate ways to actually complete the census. Next slide, please. All right. So actually, in the 2020 census, it's actually the first time that older adults just by their age are considered hard to count. And the reason for this is that this is the first time ever that the decennial census is being completed online. I'm sure we all know older adults who are very comfortable using technology, as well as many older adults who are not. So the Census Bureau is paying attention to this particular age demographic. In addition, you can see listed here, this is a whole host of demographic traits that relate to older adults, and obviously as well as people of all ages, that might make them unlikely to complete the census for a variety of reasons. We know that this list is not exhaustive, but it does give you some sense, if you're thinking about your outreach plan, about who to target. We also just want to note that there are some demographic traits on here that might intersect with someone having a fear or mistrust of the government and of giving information to a government entity. So we just want to, again, be aware that there might be people who are saying, oh, I don't feel comfortable giving my information, which is an opportunity for you to say that your information will be kept safe within the Census Bureau. Next slide. All right, so now we have our fun map section. We're going to show you a series of maps that are all online that can help you with a number of your different outreach and targeting strategies. So the first map we're looking at is called the 2020 Hard to Count map. It was developed by the Mapping Service Center at the City University of New York. And this map provides information on 2010 census information, including such as the self-response rate, as well as and at-risk populations, which are similar to hard-to-count populations. You can see the list of the different categories of information you can look up on the right-hand side of the screen. So we want to note that the term self-response, you can see it says census self-response rate. Self-response means the rate of households that responded to the 2010 census by mail or by phone. So then when we talk about we'll talk about that in a minute. So the graphic that you can see here shows every census tract across the country, and a census tract is defined as a particular geographic area that the Bureau has deemed a tract that is typically about 4,000 people. And what you're looking at here is the different census tracts are based on the color, and you can kind of see the color legend there. And that color legend shows you how households will be receiving their first mailing, whether it will be in English or bilingual in English and Spanish, and whether it will include or not include a paper form, because about 15% of households who are likely not to have computer access will be receiving the paper form initially. Next slide, please. All right, so we showed you one map that can really help you with specifically targeting hard-to-count populations around the country. This next one is called the Rome map, and this is actually run by the Census Bureau. And this map makes it easy to identify hard-to-count areas, as well as providing a socioeconomic and demographic profile of these areas. What's unique about this map is you can see on the right-hand side, we honed in on in Arlington, Virginia, where the Office of Grantmakers In Aging is, to see what their likely response rate was. And what you can see is it says the low response score of 25.2. This is actually a prediction of the percentage of people in this census tract that will likely not respond to the 2020 census. This is based on 2010 census response data, as well as an algorithm of other response rates to other surveys, such as the American Community Survey. It also gives you a whole host of other information related to the demographics of the people that live in that particular census tract. What's nice about this map is you're also, again, looking at the census tract, but here, this is showing you the lighter colors on the map, so kind of like the pale yellows, shows you that means that they will likely have a higher self-response rate, and the darker colors, like the blues, mean that it will likely have a lower self-response rate in the upcoming census. Okay, next slide, please. So now we're going to bring it back to where we are sitting, which is in New York City. And this is actually our own mapping tool that we created at the New York Academy of Medicine. It's called Image NYC, the Interactive Map of Aging. This map has data specifically on older adults who live in New York City. And if you find that this type of information is useful to wherever you live, we are, of course, happy to speak with you after the webinar about ways of perhaps adapting this to the geographic area where you work. So Image NYC was debuted in January 2010 as a response to another crisis that we were going through, which was Hurricane Sandy, when we realized how beneficial it would be to understand visually where older adults live and where resources did and did not exist near where they were. We created it in partnership with, again, the mapping service at the City University of New York with their graduate center, and we received funding from the Samuels Foundation, as well as FJC, a foundation of philanthropic funds. So taking a look at this particular map and this screenshot, we are now looking at demographic data on older adults who have no computers in their home. And you can see the legend that shows you the percentage, and the darker the color means the higher the percentage of older adults that do not have a computer. So that tells us that there's a likelihood that they will not respond online and may not respond at all to the 2020 census. Next slide. Okay, so in addition to giving us a lot of demographic data on the Image NYC map, Image NYC also shows us a number of different services and resources that can also help in terms of census partners and just information that helps our older adults in their daily lives. So in this particular map, now what we're looking at is another hard to count demographic. So the dark green that you see, which is in a neighborhood of the Bronx, is a demographic that is showing that over 90% of the older population speaks Spanish and speaks English less than very well. So that tells us, again, that this is likely going to be a hard-to-count population, but because we have these extremely useful services and resources, such as a local library, a recreation center, and a hospital, we know if we were planning an outreach plan that we can work with all of these different organizations to help us get out the count for the upcoming census. Next slide. So in addition to some census-specific as well as New York City-specific interactive maps, we want to tell you about two national interactive maps that can provide useful information to help you better understand the demographic and socioeconomic factors that make up the regions in which you work. So the map on the left is called Measure of America, and it provides a well-being index for every state, as well as a ranking of states based on a number of demographic data points. So in this graphic that we're looking at on the left, the states with the darker shades of orange indicate a higher percentage of adults 65 and older. You will not be surprised to learn that Florida ranks #1, coming in at 19.5% of the state's population. The well-being index for Florida, however, among all ages, is squarely in the middle of the 50 states. So we encourage you to check out this map after the webinar. The map on the right-hand side is called the City Health Dashboard, and that provides a range of information on health outcomes and contributors to health outcomes, such as socioeconomic factors and the built environment. So we went all the way west for this one to Los Angeles County, and what we're looking at here is we're looking at the county from the perspective of income inequality. So the darker the shade of blue, the more pronounced income inequality is for people of all ages. So I will now turn it over to my colleague Alyssa, who will give us specific strategies for ensuring older adult participation.
Wonderful. Thank you so much, Ilana. Next slide, please. Hi, everyone. Good afternoon or good morning if you are on the far West Coast. My name is Alyssa Kies, and I'm a policy associate at the New York Academy of Medicine and a co-author of this report. So I'll be discussing how to develop your census outreach strategy after you've identified who the hard-to-count older adults are in your constituency and where they're located using the maps that Ilana's just described. So many of you are already trusted and effective messengers among your clients and within your community, but now the goal is to become an effective messenger of the census. So when encouraging census participation, it's important to emphasize the positive outcomes. As Ilana mentioned earlier, the two big benefits of census participation are congressional representation and resource allocation. I will remind us all that the census determines how $675 billion of federal funding will be distributed annually to many programs that improve the quality of life for older adults and their families. It also determines how many representatives each state has in the House of Representatives and the Electoral College. It's important to make these benefits feel as tangible and relevant as possible when you're doing census outreach. So have some concrete examples on hand to illustrate your point. For example, census data determines how $70 billion in Medicare funding is distributed. And although we're talking about older adults, we know that they're not only concerned with programs that affect them because of their age. So you can mention that, for example, programs like WIC, Pell Grants, the National School Lunch Program, National Highway Planning and Construction, all of these are funded based on census data. We know that federal funding already does not provide adequate funding for many of these programs, but the sad irony about this is that the populations that are already underserved and are already less likely to take the census, if they don't take the census this year, they'll receive even less. So it's really important to emphasize the importance of how federal funding relates to funding for specific programs. At the bottom of this slide here, there's a reference to a George Washington University report called Counting Dollars for 2020 that shows a breakdown of how federal funding was allocated across each state based on the 2010 census. So please feel free to look that up. It's a tremendous resource. Next slide, please. So sometimes it's hard to picture yourself within a number as big as $675 billion. So we know that census data are also used outside of allocating federal funding. So maybe when you're talking to people, it is more helpful to share examples such as how planners and policymakers use census data to improve public transit, such as where new bus shelters or new bus routes should be located, where to locate new libraries, senior centers, hospitals, and where to deploy emergency response services in cases of catastrophes. So, as an example of how census response rates relate to local amenities and resources, we use the Image NYC map to find a census tract in Brooklyn in the neighborhood of East Williamsburg that had a high self-response rate to the census and a high number of resources. So what we're looking at right now is this light blue shaded census tract that is surrounded by a number of hard to count census tracts that are indicated by the yellow, orange, and pink or red shading here. And we see in this licensed census tract, there are large numbers of icons that all represent local neighborhood resources. So a few facts about this neighborhood. In this neighborhood, 58% of households headed by someone over 65 have an income lower than $25,000 per year. And 38% of the older adults in this neighborhood are foreign-born. So it's not necessarily a neighborhood that you would expect to be highly resourced or to have a particularly high response rate to the census. But in this case, it does. And a high self-response rate in this case correlates to a high number of amenities. So here, the icons that we see indicate bus shelters, senior centers, public pools, benches, libraries, federally qualified healthcare centers, especially in comparison to the red and yellow neighborhoods or census tracts shaded around it that have a few subway entrances and benches, but not much else. So this is all to say, you can use examples beyond just federal funding allocations to make powerful arguments for completing the census. Next slide. The final step in planning your outreach strategy is to develop an approach that resonates with your audience. One of the best ways to do that is to involve them in the planning process and to have them become effective census advocates as well. We really encourage you to think outside the box when it comes to doing census outreach. For example, when we do outreach to older adults, we often think senior centers. But we know that that only reaches a small subset of the population, and in a time when people may be congregating in person less often, it's important to emphasize other methods of communication, including your mailing, your email, and communication by phone. Consider strategic media placements on the radio, on TV, or in the newspaper, and really try to be specific and economical about your choices. So is your population reading the Washington Post? Are they reading the local newspaper? Are they listening to a certain radio DJ or a show? Those types of questions, as well as the ones listed on this slide, are important ones to ask yourself as you develop your outreach approach for your specific audience. Next slide, please. During our stakeholder interview process, the experts we interviewed shared a wide variety of potential trusted messengers. So those people included more obvious messengers like medical professionals, faith-based leaders, and local elected officials, but it also included adult children, tenant association leaders, pharmacists, barbers, hairdressers, paid caregivers, meal delivery personnel. So really think outside the box, get creative, and put yourself in your audience's shoes when you're developing your outreach strategy. Next slide, please. Finally, I just wanted to make everyone aware that this year, disinformation about the census will be spreading, including on social media, as well as private networks, private messaging apps such as WhatsApp or other text messaging platforms. So what we're looking at here is on two images that were created to spread false information about the census. The image on the left is a fake ACLU graphic in Spanish that reads, "If you receive a census form, don't fill it out. ICE will find you and deport you." And in the center is another kind of viral disinformation message that was spreading via WhatsApp. So we know that older adults can be more vulnerable to scams and fraud. So if one of your clients or somebody you know brings a concern like this to you, be prepared to spot disinformation, as well as to share how census information is collected, including what type of information, as well as what type of information is not collected. So for example, a census worker will never ask you for your social security number, for your bank information. They will never ask you for any type of money or a donation. So as a trusted messenger within your community, it's important to be able to counteract false information. Next slide. So now we're moving into our final step of our best practices, which is to facilitate census completion. It's not enough to just be motivated to take the census. People also need to have the capacity to take the census. So the next step in conducting census outreach is to develop a tactical strategy to facilitate the completion of the census. The Census Bureau provides many resources, including language guides, Braille guides, and large print guides. Finally, if you're not going to provide those resources, or maybe you're just not that type of organization, you don't have a storefront, or people aren't coming in on a regular basis, you want to at least know what those resources are and how to help someone quickly find those resources. I included a reference to regional census centers at the bottom of this slide that can be a great resource, as well as your local library, as many libraries are already involved in census outreach. Next slide. So I'm sure as aging service professionals and those who represent organizations, you already have communication and engagement channels for reaching older adults. So you don't have to reinvent the wheel here. You can use those channels for pushing out census messaging. Use your mailings, newsletters, emails, events, and daily conversations to talk about the census and make announcements. Ensure that your staff who work directly with older adults are effective census messengers, especially if you have homebound clients. You'll want people who deliver their meals or the people who contact them by phone to be promoting the census. April 1st, 2020 is Census Day, which is a big day of events across the nation that are all dedicated to promoting the census. It's not the first or the last day to take the census. It's just a big day of coordinated census activities. If it's the case that you are not doing in-person gatherings on April 1st, consider phone banking or sending out a newsletter promoting census participation. In general, doing your census outreach does not have to be an expensive or time-consuming process. It can really be built into the things that you're already doing. Also, I want to point out at the bottom of this slide are a number of links to U.S. Census Bureau social media pages, which have tons of information and messaging, often in many different languages and for many different audiences about the census, and they are always very happy when you share them. So please tap into those resources. Next slide. All right, so the next steps for all of us are to, 1, please download our full toolkit, share it widely. It is available as a PDF at the link here, nyam.org/publications, and share it widely. One easy way to educate your colleagues about what you've learned during this webinar is by forwarding it to the people in your network. The next step is for you to organize a staff meeting on census outreach. And finally, when you get the notice in the mail, which should be any day now, please do fill out the census. It's really important that all of us lead by example in taking part in this historic count. And if you have any questions, we are more than happy to answer them now, and I believe that John is going to moderate. Thank you so much, everyone.
Thank you so much for all of your great information about the importance of the census and the importance of making sure that all older persons are counted as well. So we're going to turn to your questions at this point. Please remember that you can open your question box at any point and that's on your screen, and take a look and see what just go ahead and type in your question and we'll be speaking about them now. So we have a number of questions for you. One is there will be copies of the slides made available to everyone. We will be sending you the link to that after this presentation. So one of the questions is, what is the source of data on the 65 plus households without students? Do you know that number?
Sorry, John, could you repeat that question? What is the source of data on which data point?
On the percentage of older people who do or do not have computers, and probably add to that internet access.
It's based on census data, and it's based on a number of different, the Census Bureau has a number of different surveys in addition to the decennial census, including the American Community Survey, which the sample surveys. So if you go to the Image NYC map, then it'll actually show you exactly the specific source of the data, but it all primarily comes from the Census Bureau.
All right. Have you found that there are major differences between urban and rural settings in getting this message out?
A good question. I think that because we're an urban setting, we've focused mostly on urban resources, but I think the best practices still apply. So you have your community, you know who your constituents are. So I think it's best to work through your audience that you're already in contact with. And if you're in an area that has a smaller population, you actually might be better equipped to have a sense of who exactly is less likely to take the census based on your personal knowledge of who these people are. In general, in very rural areas, there will be a concerted U.S. Census Bureau outreach to either hand deliver packets or to do more concerted in-person enumeration. And the nice thing about the first two maps that we showed you, the hard to count map and the roam map, is that it's census tracked for no matter where the census tract is. So you can really get a lot of specific information that can help you no matter whether the area is very urban or very rural.
Great. The next question is, we have begun hearing that some of our partners are having difficulty with census outreach activities because of the caution over coronavirus. We're seeing that nationwide, obviously. Do you have any particular strategies or creative ways to conduct outreach to older adults in the midst of the outbreak that could replace these events? And is there any guidance on this, on coronavirus and how it affects the census from the Census Bureau itself?
Yeah, so we actually have someone from the Census Bureau who is on the line named Abdallah Hassan. So if we're able to unmute Abdallah, then he can answer the first part of the question, then maybe together we can answer, the second part of the question, and then maybe together we can answer the first part around census activities.
Abdallah, I've unmuted you if you're able to speak. Thank you.
I think what we want to do is that we want to focus on having people self-respond to the census. Yes, it might be more difficult to have large gatherings in which people can respond to the census or have census outreach events, but we want to really convey the message that it's very important to encourage self-response. It's very important to have people know that they can respond online or by phone in English and 12 non-English languages. So that's the message that we want to convey. And we want to make sure that everyone's counted and that if they do self-respond, then no one is going to visit them at their home to get this information.
Thank you. And I think in terms of kind of specific outreach, you know, there's so much that we just don't know about kind of the time frame of this virus. So the census period is somewhat long, so it's obviously starting now, but really going through the summer. So there's a lot that can change, hopefully for the better as time goes on. And the other thing is that in the toolkit, we have a section specifically related to outreach for older adults that are not able to leave their homes. And that includes a lot of mailings and phone calls and things that we kind of touched upon in this webinar. So we might just have to employ more of those strategies to a larger audience than we once thought, because more people will likely be staying home over the next month or so.
Great. Can people take the census before receiving their official invitation?
They can take it online starting tomorrow by going to 2020census.gov.
What the census letter is going to include is a 12-digit code, and that 12-digit code is a stand-in for people's address. So yes, they can take it even before they receive their invitation to respond. It would just mean that they would just answer an extra questions on their address and the cross streets. But yes, they can take it even if they have not received an invitation yet.
Great. This is a specific question about people that are in institutional care. Could you speak again about how the census is going to work in assisted living and nursing homes and other long-term care facilities? How will they be counted?
Abdullah, do you want to answer that?
That falls under the group quarters enumeration process for the census, and as was mentioned, that group quarters enumeration varies. It could be an arrangement with the facility to have that information electronically sent to the census. In some cases, there's a paper questionnaire that's sent to the facility, and it's filled out and returned to the Census Bureau. And other times, the Census Bureau trains staff at those facilities to collect the information and to deliver it to the Census Bureau. So there's different ways in which group quarters are enumerated.
Okay. The next question is a more general one, and that is, which factor other than age do you think is the most critical in terms of making someone hard to reach?
Making someone hard to count?
Yes, yes, hard to count.
We're thinking.
Well, those factors not only include age, of course, but it could be someone who immigrant status. New immigrants are harder to count because they're still navigating, what it means, life in America. They might receive an invitation to respond to the census. They don't know why the government wants this information. So new immigrants are hard to count population. People experiencing homelessness are another hard to count population. Transitory people who are moving around a lot are usually hard to count as well. So there's different factors that contribute to low response rates, but we want to make sure that we work with trusted voices in communities, faith-based institutions, community leaders, build those relationships of trust so people know that it's important to respond to the census and why it's important to respond to the census and how it directly affects the resources that their communities receive.
Absolutely, and in the conversations that we've had with other experts, a lot of people have expressed concern that people who are immigrants and who have different citizenship statuses are, even though there will be no question on it, are still going to be really hard to convince to complete the census. There's another issue that's come up, which is because the Census Bureau provides a lot of different surveys, and because it's also tax season and it's also election season, people are getting all sorts of forms from different governments. And so some people might actually think that they completed the census this particular 2020 census, when they in fact have not. So we want to make sure there are lots of graphics that you can easily find online to show what the 2020 census form looks like. So you can say, if you think you filled it out, you can say, oh, well, did it look like this? Did it ask you 10 questions, et cetera, to ensure that they probably have not yet completed the census because it has not even started until tomorrow.
Well, that actually leads us to what is going to be our last question, which is, are you encountering scams that are directed towards older people around the census at this point? And if so, what kind of advice do you give people?
Yeah, so I actually want to refer to now, AARP has an excellent video around scams and fraud related to the census, specifically in relation to older adults. I think that I don't want to name specific scams because I think it can take so many different forms, but in case of counteracting scams, it's really important just to know the basic facts about the scams so that when you encounter one in any form, you know when it's not real. So for example, a census worker will never call you on the phone to initiate you taking the census. They will never say, hey, I noticed you haven't filled out the census. Can you fill it out now? That will never happen. A census worker, again, as I said before, will never ask you for money or donations or your bank information or your social security number. So knowing the way that the census is conducted, knowing what type of information is collected, and kind of priming yourself to see those graphic images of the disinformation that I showed earlier will really help you in spotting fraud and becoming more immune to it. Again, I'll reference the AARP video. If you search AARP census fraud, then I'm sure you'll find it.
And also, if you ever have any questions about whether something is a scam or not, you can always email rumors@census.gov, rumors@census.gov.
Thank you. Great advice. Just to everybody whose question we're not going to get to, we will be answering all these questions with our panelists and sending that out with the rest of the material. At this point, I'd like to turn back to our panelists and ask for their final words of wisdom to the group today. And Alyssa, let's start with you.
Okay, great. Thank you so much. We just want to thank everyone again for joining us on this webinar. You can see our contact information here. If you have follow-up questions about the toolkit and or if you're interested in learning more about the Image NYC map and how it can be adapted to where you live, we are more than happy to speak with you. And we just want to thank you really for joining us, particularly during what has turned out to be quite a hectic week and month for many of us here. We know that you have many competing priorities, but we actually think that this national crisis has shown us just how important it is to understand where older adults live and what types of services they really need to live well. And one of our best tools to obtain this information is the upcoming census. And participating in this national effort is actually really a humbling reminder of how individual actions actually do have a collective impact. So we thank you for your time and your efforts. All right, thank you so much.
Thank you, thank you. Alana?
Oh, all right. I can't say it any better than Ilana. I think that this is really an important opportunity for us to have an incredible collective impact. This is as important as voting. And I think a lot of people kind of don't consider it to be their civic duty, but it really is. It's important for yourself, for your family, for your community. I really want to thank Grantmakers In Aging for having us on this webinar this afternoon. I want to thank everyone for joining, and thank you so much to Julio and the Samuels Foundation for funding this project.
Julio, let's turn to you as our last speaker today and say a few words about how this applies to other foundations who are thinking about this effort.
I certainly will. I wanted to also GIA. We actually find ourselves at the foundation for a number of initiatives and models that they've created. We don't have the resources that the Hartford Foundation does, but we do have the resources to replicate, some of the work that they've been able to do. And I think that this is an opportunity now for us to offer this toolkit to our colleagues at foundations so that they can share this resource with some of their grantees as a way of giving back. This also allows us to get a bigger bang for our philanthropic dollar if we can get this toolkit into more hands so that they can be used. We know that this field in general is underfunded, and perhaps this is a way of trying to ensure that the appropriate level of resources are available to the population that we care about most. So again, thank you for participating in this seminar or webinar, and please take advantage of the work that we've been able to do and allow us to realize a greater return on our investment.
Thank you so much. I want to thank Alana Kiefer and Alyssa Kias of the New York Academy of Medicine and Julio Urbina of the Fan Fox and Leslie R. Samuels Foundation for their great work today. Thank you for the work you're doing and for all of your great work in supporting older adults with the development of this toolkit. I also want to thank the Johnny Hartford Foundation for their support of this webinar and our entire webinar series. As I mentioned, we will be making today's presentation available to anyone who wishes to view it later, including both the slides and the audio. Please watch for an email to be sent to you in a few days. And finally, thank you for all of you for participating in today's webinar. Please stay safe, and have a great day.